Manoscan, motility made simpler, faster, more precise. Powered by high-resolution tactile technology, Manoscan simplifies data collection and provides an intuitive visualization of motility. It gives greater diagnostic information while reducing procedure times by up to 50%. The high-resolution circumferential catheter eliminates the need for precise probe positioning and is immune to physiological asymmetries. Manoscan's built-in auto-calibration function, touchscreen control, and intuitive software interface set new standards in ease of use and diagnostic acuity. Manoscan provides an unprecedented view of motility, allowing you to readily identify normal and abnormal physiological signatures and efficiently analyze collected data. For esophageal manometry, Manoscan provides full coverage from the pharynx to the stomach. The pressure profile on the right shows the real-time distribution of pressure in the organ, while the main display on the left gives the history of the study. This high-resolution format gives a clear overview of motor function. The display may be switched instantly to view the same data set as line traces at discrete locations. The pressure profile may be viewed as a color map or as a line trace for quantitative pressure assessment. The high visibility of upper and lower sphincters assists in probe placement and data interpretation. Manoscan employs intuitive new tools to assist the procedure and data analysis. Graphical guides facilitate localization of anatomical landmarks. The LES, PIP, and UES are readily identified so that data may be analyzed at their true locations. A graphical depiction is available that superimposes pressure on the anatomy, and the data may be displayed relative to gastric or atmospheric baselines. Physiological signatures, such as arterial pulsation and respiratory cycles, are readily seen in the display. Touchscreen controls and simple recording functions save time during clinical data collection. Timescales are fully adjustable, and pressure ranges are easily changed, together or individually. A watch window function displays the high-resolution pressure images while in line trace mode, and channel positions are adjusted precisely relative to the true anatomical locations. Manoscan means simplified clinical procedures. For esophageal manometry, simply place a probe in the esophagus, allow a brief acclimation period, record swallows, and you're done. The full esophageal data are automatically collected. These benefits of Manoscan's advanced data capability continue from the clinic to data analysis. Let's explore these in several representative case studies. Normal esophageal motility. In this subject, anatomical landmarks are distinct, and the pressure inversion point is within the margins of the LES, indicating no hiatal hernia. LES basal and relaxation pressures are normal. Peristaltic velocity and relaxation at the EG junction are normal. Achalasia type 3. Adjusting the pressure scale, we see that peak pressures exceed 500 millimeters of mercury. We similarly adjust the line trace amplitudes. Note that the LES does not sufficiently relax, and observe the high wave amplitude in the pressure profile display. Hypotensive LES with hiatal hernia. In this case, the pressure inversion point is clearly seen to be below the LES, and a 5 centimeter hernia is identified by simply moving the anatomical markers. The LES pressure manifests only briefly at the end of the swallow with a near complete loss of resting pressure at the sphincter. This loss of tonic contraction is also seen in the green LES line trace. The high-resolution display confirms that this is indeed an extremely hypotensive sphincter abnormality, rather than a case of an incorrectly positioned catheter, a situation that cannot be resolved from data collected with conventional devices. incomplete LES relaxation resulting from post-fundoplication obstructive changes. In this post-operative case, the pressure barrier at the EG junction persists at a time in the swallow sequence when the LES would normally relax. The sphincter appears to relax in the line tracing. But the high-resolution view shows that the barrier pressure region has moved proximally during this phase, causing symptoms of dysphagia. The Manoscan high-resolution tactile technology also provides for simple and efficient anorectal manometry testing. With many of the same features and benefits as the Manoscan esophageal software, the Manoscan anorectal software allows for similarly intuitive data collection. The probe's continuous sensing provides full coverage from the sphincter to the rectum, eliminating the need for repositioning. These balloon sensors in the rectum also do away with the need for an EMG signal in the abdomen. A resting pressure frame is captured before the patient performs several standard maneuvers, such as squeezes, bear downs, and balloon fills. Customized annotations such as sensation, urge, and discomfort also help add detail to the study. Let's explore some case studies. Normal anorectal manometry. In this subject, there is no pressure in the rectal balloon during the squeezes. During bear downs, you can see pressure generated in the rectum, descending distally toward the anal canal along with simultaneous relaxation in the anal canal. Length of sphincter and pressure in the sphincter are normal. Dysinergia, or anismus. In this case, when the patient is instructed to bear down, they squeeze instead. Additionally, rectal pressure is very high during these maneuvers. The difference is easily visualized when compared to a normal subject with appropriate bear down pressures. Hirschsprung's disease. In this subject, there is no relaxation in the sphincter during a balloon fill maneuver. The difference is easily visualized when compared to a normal subject with appropriate rear during a balloon fill. Low technician training requirements. Consistent and reproducible data sets. Shortened clinical procedures. And nearly 10 times the diagnostic pressure information. That's the Manoscan advantage.